My 8-year-old patient was going into high-risk heart surgery. His last words before anesthesia left the entire surgical team speechless. Have you ever witnessed a moment so unexpected it completely shattered the emotional atmosphere in the room? As an anesthesiologist at Children's Memorial Hospital for 15 years, I've heard countless things from patients drifting under sedation, part confessions of stolen cookies, declarations of love for cartoon characters, even marriage proposals to nurses. But nothing prepared me for what happened with 8-year-old Ethan last spring. Ethan wasn't your typical pediatric patient born with a complex congenital heart defect. He'd already undergone 2 open heart surgeries by age 4. Now at 18, needed a third pair in a high-risk procedure with significant complications possible. Despite this, Ethan had developed the kind of resilience and dark humor that sometimes makes medical professionals forget we're dealing with a child. The first time I met him during pre-op evaluation, I introduced myself as Dr. Michaels. He looked me up and down, noticed my Chicago Bears lanyard, and immediately declared right eye bigger rule, Bears drool. His mother apologized, but I laughed. Part trash talking sports was our thing from that moment on. The morning of surgery arrived and the atmosphere was tense. This would be Ethan's most complex procedure yet, a pulmonary valve replacement with additional repairs. The surgical team had been briefed on the significant risks: excessive bleeding, heart block, even the possibility we might not be able to wean him from bypass. XNN felt the weight of what we were about to attempt. As we prepared in the OR, Ethan's mother was allowed to accompany him until anesthesia induction PERN, a courtesy we extend for high-risk cases. She held his hand while I explained I'd be giving him medicine that would make him feel sleepy. When you wake up, you'll be in the recovery room with a tube helping you breathe, but your mom will be right there, I explained, keeping my voice steady despite knowing the statistical odds we were facing. Then he squeezed his mother's hand and said, "Mom, I need to tell you something important before I go to sleep." The room grew quiet. These moments before high-risk surgeries can be profound. PERN children sometimes show wisdom beyond their years. Sensing the gravity of the situation, nurses paused their preparations. The surgeon looked up from reviewing the imaging one last time. Ethan's mother leaned close, tears forming in her eyes. "What is it, sweetheart? I love you so much," he said, his voice suddenly small. His mother choked back a sob. "I love you too, more than anything." I had just administered the first dose of sedative and could see Ethan's eyelids getting heavy. These would likely be his last words before surgery. The emotional weight in the room was palpable. Part even our most experienced surgical nurse was blinking rapidly. Then Ethan's eyes flew open one last time with the slurred speech of someone fighting the pull of propofol. He looked directly at his mother and said, "Mom, I forgot to tell you I put your phone in the toilet this morning." It was an experiment. His eyes closed as the medication took full effect, leaving his mother frozen in shock, her mouth open mid-sob. For 3 heartbeats nobody moved. Then our charge nurse snorted, trying desperately to maintain composure. The surgeon's shoulders began to shake. I bit my lip so hard I nearly drew blood. His mother broke first, laughter bursting through her tears. "That little, even now, he's pulling pranks." The tension that had gripped the room transformed instantly. The surgical team, moments ago solemn and focused on the risks ahead, was suddenly energized. Even the surgeon, known for his intensity, was smiling as he called for the final preparations. That surgery lasted nearly 9 hours. There were moments when we nearly lost Ethan, part his heart struggling to resume function after bypass, unexpected bleeding requiring additional transfusions. But throughout the procedure, whenever tension peaked, someone would whisper it was an experiment, and determined smiles would return to masked faces. Ethan recovered fully at his 6-month follow-up. I asked if he remembered what he'd said before surgery. He grinned mischievously and asked if his mom had gotten a new phone. "You know," his cardiologist told me later, "here's research suggesting positive emotional states among surgical teams correlate with better outcomes." I wonder if that little prankster somehow knew exactly what we all needed in that moment. I've often thought about that day, Pert, how a child facing his mortality chose laughter as his parting gift, how his experiment might have transformed the energy in that operating room in ways we can't measure but somehow felt. Sometimes the most powerful medicine doesn't come from our pharmacy. Sometimes it's delivered by an 8-year-old prankster with a broken heart who somehow knew how to mend ours.